Good morning, everyone. This is chapter 20 and it's on delegation. Delegation is also known as deputation, is the assignment of authority and responsibility to another person, normally from a manager to a subordinate, and it is to carry out specific activities. However, the person who delegated the work remains accountable. For delegation empowers a subordinate to make decisions. For example, it is a shift of decision-making authority from one organizational level to a lower one. If delegation is properly done, it is not abdication. The opposite of effective delegation is micromanagement, where a manager provides too much input, direction, and review of delegated work. In general, delegation is good and can save money and time. It can help build skills and motivate people. Poor delegation, on the other hand, might cause frustration and confusion to all the involved parties. Delegated tasks. The right to delegate and the ability to provide formal rewards for successful completion of delegated tasks reflects the legitimate authority inherent in the management role. So the manager has legitimate authority to delegate and also provide rewards to whomever he or she is delegating to. Sometimes managers must delegate routine tasks so they are free to handle problems, the more complex and the ones that require higher level of expertise. So the manager needs to know when and how to delegate. Delegation. Delegation is an essential element of the directing phase of management process. Although much of the work is accomplished by managers by their own effort, it also occurs through the work of their subordinates. Delegation is a necessity, not an option. When there is too much work to be done by one person, delegation becomes synonymous with productivity. Let's take a look at some statements of what delegation is all about. Delegation is getting the work done through others, directing the performance of one or more people to accomplish organizational goals. It provides learning or stretching opportunities for subordinates. Remember that stretching is getting away from your comfort zone, letting this person learn new things. It also increases power. So when you delegate somebody some work, know that it increases their power as well. You cannot delegate anything to anybody without delegating some power. And never delegate the total responsibility. It is still your duty and your responsibility. You are still accountable for whatever you're delegating or you choose to delegate. Don't delegate responsibility without authority. That person needs to have the appropriate power to meet those goals. And don't delegate only the boring jobs. Remember, you want to motivate your subordinates and you want to stretch them. So delegating is an opportunity to give adequate stretching for your subordinates. Managers may delegate work if someone else is better prepared or has greater expertise or knowledge about how to solve a problem. Delegation is a managerial tool for subordinate accomplishment and enrichment. For nurses, delegation is not an option but a necessity. There are some rules to follow when you are looking at delegation. Always delegate to the right person. You have to know that it's the right person with the right skills in order to accomplish the right task. It has to be at the right time and for the right reason. You need to say no when you must and reward subordinates for a job that is well done. You need to know the skill set of each individual that is working with you in order to delegate them correctly. Causes of under-delegating. Fear that delegation may be interpreted as a lack of ability to do the job completely or correctly. Delegation need not limit the manager's control, prestige, and power. Rather, delegation can extend the manager's influence and capability by increasing what can be accomplished. The right to delegate and ability to provide formal rewards for successful completion of delegated tasks are a reflection of the legitimate authority inherent in the management role. So don't let fear interfere with your delegation. Desire to complete the job by himself or herself. This implies a lack of trust in subordinates because the manager believes he or she needs the experience because he or she can do it better and faster than anyone else. Time spent training another person to do a job is much repaid in the future. Remember, we talked about this in time management. Delegation, in addition to productivity, provides the opportunity for subordinate to experience feelings of accomplishment and enrichment. Fear that staff will resent having work delegated to them. Delegated work actually increases employee satisfaction and fosters the cooperative working relationship between managers and staff. Lack of experience in the job or in delegation himself because they have an excessive need to control or to be perfect. Refusal to allow mistakes limits the opportunity available for subordinate growth and results in wasted time as the manager completes or recompletes delegated tasks. Does the manager want satisfying or maximizing work completed? This must be clear at the onset of delegation. Not all delegated activities need to be maximizing. Some novice managers emerging from the clinical nurse role underdelegate because they find it difficult to assume a manager role. This occurred in part because nurses have traditionally been rewarded for their clinical expertise, not their management skills. And so you want to make sure that you are ready to be a manager because delegation is part of your job. And another cause of under delegating is because you enjoy your job or you enjoy the work and you tend not to delegate so much. Process of over-delegation. Managers who over-delegate do not become overburdened, but burden their subordinates instead. So over-delegation is just as bad as under-delegation. Sometimes these managers have poor management of time. They spend the entire time just trying to get the work organized. They tend to over-delegate because they feel insecure in their ability to perform a task. So insecurities may play up a role in over-delegating. The manager might not feel secure in their abilities, so they're always delegating their tasks. Managers also must be careful not to over-delegate to exceptionally competent employees because they may become overworked and tired, which can decrease their productivity overall. Causes of improperly delegating. It could be the wrong time to the wrong person or for the wrong reason beyond the capability of a person. Or it could be something the manager should do, decision making without providing adequate information. Delegating decision making without providing adequate information can happen in complex organizations when efforts have been made to delegate decision making to middle level managers. When this occurs, new channels for sharing information need to be established. If the delegated decision making processes moved from one level of management to another level. Delegate, don't abdicate. Abdicate means giving the whole job or task away, and that is not what delegation is. You keep the responsibility and accountability for whatever you delegate. You don't want to consult with the employee. Make sure that they have the ability and skill set to do what is being delegated to them. Clear communication and delegation. Communication must be clear. The tasks to be done must be clearly defined. The delegates must be able to know exactly what you want them to do. You want to delineate the end results you expect, when you want the work done, and what standards you will use to determine whether it is adequate. They need to know all this upfront. Be careful though to delegate the objective, not the procedure. Allow employees to use some creativity in achieving the desired end product. For example, when you delegate a work to your certified nursing assistant, don't tell her how to organize her work, but give her the objective and what end results you will expect. Satisficing versus maximizing mode. If the delegator requires a higher quality than satisficing, this must be made clear at the time of the delegation. Not everything that is delegated needs to be handled in a maximizing mode. So basically, it must be communicated to the person that you're delegating the work, whether you want it in a satisficing mode or in a maximizing mode. Monitoring delegated tasks. Managers should ask the individuals to whom they are delegating if they are capable of completing the delegated task, but should also validate this perception by direct observation and monitoring their skill set. Monitoring delegated tasks keep the delegated tasks before the subordinate and the managers so that both share accountability for its completion. Delegation as a function of professional nursing. RNs at all levels are increasingly expected to make assignments and supervise the work of different levels of employees. RNs as clinical managers and they are expected to be expert at delegating errors and are asked to assume the role of supervisor and delegator, need preparation to assume these leadership tasks. Some experts argue that the RNs, although well trained in the role of direct care provider, is often inadequately prepared for the role of a delegator. So it's oftentimes very difficult to assume these roles and feel adequate to be the one delegating and supervising. So what are the issues regarding delegation for them? The clinical agencies are nurses prepared? Are they doing a good job of supervision and delegation? These are some questions you need to ask for yourself and find the answer. Resistance to delegation. Resistance is a common response by subordinates to delegation. So if you are the one delegating, you need to be aware that you can have some resistance. Many times, the major reason for this resistance is failure of the delegator to see the subordinate's perspective. Sometimes it could be because you are over delegating tasks in terms of specificity. So when you delegate, you need to know where your subordinates are coming from, what is their perception of the situation. And when it comes to over delegation, also you need to see a subordinate can be stretched only to a certain limit. Once you reach that limit, you may feel resistance or you may experience confrontation from the part of the subordinates. So you need to keep these two things in mind: failure to see the subordinate's perspective and over delegation. Delegating to unlicensed assistive personnel. You need to know what tasks you can delegate to unlicensed assistive personnel. The RN is responsible for patient assessment, diagnosis, care planning, and evaluations. Unlicensed assistive personnel may perform simple nursing interventions related to hygiene, nutrition, elimination, or activity, but the RN still remains responsible for patient outcomes. In other words, you can assign tasks that does not require independent thinking and evaluation to the unlicensed assistive personnel. The idea behind assigning tasks to the unlicensed assistive personnel is that the UAPs can perform simple nursing tasks that does not require critical or independent thinking. They can complete these tasks and free up the professional nurse for more complicated nursing tasks. And UAPs can perform tasks at a lower cost compared to the professional RN. Another issue is that the liability of RNs are more when the tasks are assigned to unlicensed assistive personnel. As you know, UAPs qualification or skills are not standardized. There is no federal standards or community standards exist for the unlicensed assistive personnel's training. So their training can vary from 1 month to 3 months to up to maybe like 6 months, but there is no set standard. So you need to know your personnel, their knowledge base, their skill set, and their commitment to work. If they fall out on any of these areas, and if as an RN you fail to supervise their activity, that can also result in failure to supervise your subordinate who require absolute supervision. Standards for training the unlicensed assistive personnel. As we said earlier, there is no federal or community standards that have been established for training the unlicensed assistive personnel. So these people's training can vary from a couple of weeks to several months. It varies. So you need to know thoroughly about your personnel, their knowledge base, their skill set, and their commitment to work. Few basic questions about the use of unlicensed assistive personnel. Nowadays, hospitals tend to hire more unlicensed assistive personnel than the RNs to be more cost effective. So in this scenario, the two basic questions you have to ask to yourself is, do unlicensed assistive personnel free RNs from non-nursing tasks? Or do they require so much supervision that they hinder rather than help? The second question is that, do the lower salaries of unlicensed assistive personnel keep healthcare costs down, or do they create or amplify a whole host of other problems, the greatest of which is declining quality of care? Looks like you need to do some research on these questions depending on which area you work. Remember, the right task needs to be delegated to the right person at the right time. This completes Chapter 20. Please be sure to learn more about leadership and management roles in delegation, purpose of delegation, delegating to a multicultural, improper delegation, subordinates resistance, and tasks that can be assigned to unlicensed assistive personnel.